بسم الله الرحمن الرحيم. نحييكم والسلام عليكم ورحمة الله وبركاته. نحييكم من المركز الثقافي الإريتري الكندي في تورونتو، في مستهل برنامجنا السنوي الذي نبدأ به شهر رمضان المبارك، أعاده الله علينا بالخير واليمن والبركات. برنامجنا سيكون متعلق بثلاث نشاطات أو ثلاث مجالات، وهي الصحة، صحة العقل والبدن والروح. السلام عليكم ورحمة الله وبركاته everyone. Quick introduction. Welcome. This is the ECCC Talks with our pre-Ramadan program. We're starting our first part of the 3 sessions, which will be tonight, tomorrow, and the day after, inshallah. Today, we're going to start with the first part, which is about our health during Ramadan. I won't take long an introduction. I'll let our guest, Brother Dr AbuBaker Khalifa, internal medicine and intensive care unit physician, and an assistant professor at McMaster University in Canada here in Hamilton. I'll leave that to you, Doctor. Take this evening. I'll be here just for help. Thank you for your time, and Bismillah.
Assalamu alaikum wa rahmatullah, jazakumullah khair. I just want to make sure, do I see the people? I don't see the people on the Zoom. They're just broadcasted, right?
Yeah, yes.
Okay, excellent. Okay. Jazakumullah khair.
They see you though. They see you.
Jazakumullah khair. Thank you very much for the time. And I always enjoy coming here and talking to the community and being of support to the community. First of all, Bismillah ar-Rahman ar-Rahim. Inna alhamdulillah hamdan kathiran tayyiban mubaraka. Allahumma ya Rabb al-Alamin ij'al lana barakatan fi hadha al-jam' al-mubarak. Allahumma ameen ya Rabb al-Alamin. First of all, again, thank you for having me talk today about fasting and the impact of fasting in healthcare, with a focus in the community and the focus on important aspects around the community when it comes to fasting. So the way we're going to split up the talk today, inshallah, is we're going to talk about a few components. One, we'll talk about fasting and what fasting does to the human body. The second part is, inshallah, we're going to talk about how do different health diseases that are common in the community, not just in the Eritrean community, in the community overall, such as diabetes, heart disease, high blood pressure, how do we manage it during Ramadan, and what's the impact it can have during Ramadan? The third part, inshallah, we're going to talk about medications and some tips that we can take with us as we enter the month of Ramadan, inshallah. So first of all, when we talk about diabetes, and when we talk about fasting, we know that fasting has a direct impact on our body in different levels. First of all, the research around fasting has not just happened by the Muslim community. As you notice around us, there has been a lot of research that has been performed by major centers around the world looking at intermittent fasting, which is the concept of not eating for a segment of time. Sometimes it's 16 hours, sometimes it's 12 hours, sometimes it's 8 to 10 hours, depending on the program. And they have studied the benefit of this intermittent fasting on the body and what kind of benefits it has done. So it turns out that many papers, specifically in the last 4 or 5 years, there's been a lot of interest towards understanding how does that impact the body. So when you fast, or maybe the opposite of fasting, when you're eating, the most important organ that manages your insulin is your pancreas. And the pancreas ends up releasing insulin. So every time you fast, the pancreas will release insulin. Every time you eat, the pancreas will release insulin. And when you eat and it releases insulin, when you're eating most of the time carbohydrates, sugars of different kinds, proteins of different kinds. So it goes from your gut to your blood. And then imagine the blood, the sugars is going to stay in the blood unless the insulin comes on board. So once the insulin is released from the pancreas, what happens is the insulin goes to every cell in the body, all the organs in the body. It helps to move your sugar from the blood to your cells so the cells can grow and the cells can do its daily activities. So if you think about it, the insulin is like the taxi, taking you from the one destination, from your gut blood to inside the cells, so that the sugar in the cell can do its work, so the cells can survive, so that we can, where the children can grow, for particular cells of our body to continue, the heart continue to beat, the brain function to continue. So that's why eating and sugar is important. We have to get glucose into the cells. As much as I say eating and glucose and sugar is important, unfortunately, our diets now are generally excessive when it comes to carbohydrates. It's excessive. And when there's a lot of glucose, a lot of carbohydrates that we eat, we end up having so much sugar in our blood. The pancreas, imagine now it's working in overdrive. So it's trying to release as much insulin because our cells, we're eating so much and we're eating in different frequencies. The pancreas gets tired, and when the pancreas gets tired, it cannot release enough insulin. And when it struggles with releasing a lot of insulin, you start getting into diseases like what? Like diabetes. Because diabetes is a problem that you don't have enough effective insulin, or you don't have enough insulin. So type 1 diabetes are people who don't have enough insulin. Type 2 diabetes are ones that have insulin, but it's not necessarily a very effective insulin response. So the bottom line is how we eat and what we eat impacts our insulin levels and impacts how our insulin reacts to our body. So all of a sudden, when we take this concept around eating and insulin, we go and we say, what happens when you don't eat? Subhanallah, our body is designed with so much perfection from Allah subhanahu wa ta'ala that all scenarios, our body has very different hormones to handle it. So when you eat so much, the pancreas doesn't say, I'm going to shut off. Allah subhanahu wa ta'ala has designed it in a way to manage. When you eat too little and you fast, then the body has mechanisms, has ways to manage that. So when you don't eat over a longer period of time, what ends up happening is you end up, when you don't eat over a longer period of time, you end up not releasing too much insulin. So your pancreas is relaxing. Imagine, pancreas is relaxing. You're not releasing so much insulin. You don't have so much food. It gives your pancreas time to rejuvenate. So it will release insulin at its own pace, and it will release effective insulin. So what we call is your insulin sensitivity. The way your insulin reacts becomes very effective when you don't fast. When you fast, becomes very effective. So that's why when you fast, your insulin sensitivity gets better. When your insulin sensitivity gets better, you have low risk of diabetes, you have low risk of cholesterol buildup, you have low risk of heart disease, you have low risk of strokes. So all these things are impacted by the insulin sensitivity. Okay? Now that's the science, right? We knew this when we looked at the science. We also know that when you fast and you don't have enough, your body says, I don't have enough sugar, so I don't have enough insulin. Your body does something very interesting, as in your body does something very interesting as when there's not enough insulin, not enough insulin in your body, is it allows you to break down your extra fat. So when it allows you to break down your extra fat cells in your adipose tissue, which is the scientific term for the fat cells that we have, is we end up losing a lot of weight, and hence weight loss happens when you fast appropriately. So we know that in the science. there's been a lot of research that has been applied in the last little while, especially over the past 10 years, that has shown that intermittent fasting impacts your insulin sensitivity, your diabetes, impacts cholesterol levels, impacts your heart disease and heart health, and impacts your overall mental health and well-being, right? So I said this scientific, I wanted to go a little bit on the science because I wanted people to understand. You know, I'm not expecting you guys to have studied this or taken notes, but I want to give you that, subhanAllah, there is a science to this, and this science has been very much studied. What's important is, I always bring this up, is whenever we talk about Ramadan, may Allah subhanahu wa ta'ala bring us closer to Ramadan, is we always get asked the question, and I brought this up in my last talk, we always get asked the question, why is it that you guys fast? And immediately when you see a non-Muslim asking you that, you automatically want to respond, you know, by sounding scientifically smart. We all want to say, you know, we fast because it's good for your health, it's good for your insulin sensitivity, it's good for your diabetes, it's good for your glucose. But I think it's very important for us as Muslims to understand that, yes, fasting, one of the wisdoms of fasting is that we have more adequate and improved health. However, the reason we fast is because Allah subhanahu wa ta'ala has given us a commandment to fast. And Allah subhanahu wa ta'ala is the all-knowing that fasting is something we're doing in order to please Allah subhanahu wa ta'ala. And one of the wisdoms and one of the learnings that we have, is that we know that fasting is good for our health. So I think it's important because this is really a critical aqidah principle around fasting, and the importance of fasting is not necessarily just health, it's about the overall commandment Allah subhanahu wa ta'ala gives us to fast. As I go to the next discussion point, I want to talk and touch on the impact of fasting on particular disease states. So when we talk about the impact of fasting on particular disease states, we understand and we know that fasting can impact people with heart disease, people with diabetes, and people with strokes, people who have particular mental health problems, mental health disease. And we have to recognize as a community that we are not in a position to, as medical doctors, we're not in a position to give any type of Islamic fatwa on the legitimacy of whether you should fast or not fast from an Islamic perspective. But our direction is always, if fasting is going to cause and impact your health, we as physicians will always say that you should not be fasting because the impact it has on your health. Now, one important point I want to highlight is that it is incredibly important that we do not take this talk as, Dr. Khalifa or AbuBaker has said not to take this drug or take this medication. This is not a medical consultation. And I'm not saying that for a legal perspective. I'm saying that for your own safety and health. Because it's very important. Everyone, and I always get this, he has diabetes and he does this drug. And I have diabetes, but the doctor gave me another drug. You know, why does that happen? Every disease and every diabetes is not the same. So it's very important to recognize that these are just general advice. Please do not take this as specific advice for your particular problem. Now, when we talk about overall fasting when you have diabetes, fasting, number one thing you should do for everyone who has diabetes is to ask their doctor, are we allowed, can I fast or should I not fast? That's the most important first step. If the doctor tells you, because you are on insulin and your insulin is all over the place, it's not very regular, my recommendation is you do not fast. You have to take that recommendation very seriously because fasting can have impact on your overall healthcare. That being said, as much as I say this, when we look at the evidence and we look at the research and we look at the literature, we do know that more than 80% of Muslims who have chronic illness still fast, right? So what that gives us as a challenge for healthcare providers is we have to be able to tailor and adjust our treatment based on the new regimen that you have. So in Ramadan, what happens? In Ramadan, we don't eat for more than 12 hours. The other thing we don't do is we don't sleep very much. Our sleep night schedule is different. You might be more awake during the night. We might go to Taraweeh. Our sleep at night might be less. So our overall rhythm, what we call our circadian rhythm, is flipped back and forth. So unless you go to your doctor, and this is my first tip, my first advice, you have to tell your doctor, not on the 5th day of Ramadan, right now, 10 days, 2 weeks before Ramadan, if you have not done already, is we have a fasting month of Ramadan coming up, inshallah. With this fasting month of Ramadan, this is my life schedule, this is my day schedule, this is how much I don't eat, how can I adjust my medications, and how can I adjust my treatment plan? That becomes important. So when it comes to diabetes, if anyone who has diabetes has low sugars, so they take insulin and they have low sugars, and everyone who has diabetes and has low sugars knows what I'm talking about, right? If you have low sugars, you get dizzy, you get lightheaded, you feel very dehydrated. In your regular day, in your non-Ramadan day, you should very much talk to your doctor, because fasting might not be healthy, and it's important for you to withhold from fasting unless your doctor has made a particular plan for you. That's number one. The other part that I think is important is around your cardiovascular disease. So people who have particular health problems when it comes to their heart. When it comes to heart disease, it's very important for us to recognize that we take blood pressure medications, and people will take some blood thinners, and people will take medications that can make you dehydrated to get rid of extra fluid from your body. And when patients who are taking these type of medications, while you're fasting, it is important to recognize, don't flip around the medications as you see fit, as you wish. You say, you know what, I'm not gonna take the morning one, so I'm gonna double the night one, right? So that can have major implications for you. So it's very important for us to understand that yes, fasting helps your heart disease, helps your cholesterol levels, but it doesn't mean because it helps your cholesterol levels, I don't take my medications anymore. Khalas, I'm good, I have no problem, I'm not gonna take my medication for a month because Abu Bakr said that fasting helps your cholesterol and helps your heart disease. So that's important. The second point I wanna highlight is around how do we manage our diet when it comes to Ramadan. A lot of times it becomes critical to think what we eat. Yes, we fast, but how is our diet when we break our fast? You know, most of us here are having maximum carb load with the sambusas and the different types of carbohydrate-rich meals right when we break our fast. So what happens? Your body sees this very high energy, high load of carbohydrates. Your pancreas goes from asleep to overload immediately, a wakefulness immediately. Your insulin levels goes all over the place, and your body recognizes you have a very irregular schedule, and things are looking very, very unorganized, and disorganized. And it's important for us to consider what we eat when we fast and when we have our suhoor. So I recommend that all of us, this is just supposed to be a reminder talk, all of us to look at different type of diet plans when fasting. There's many dietitians who've spoken about diet plans during fasting, because number one, the fasting, inshallah, becomes accepted by all of us as a deed, inshallah, that can allow us to move forward in our deen. At the same time, what we do after when we break our fast, and how we eat and how we sleep and how we exercise, it might allow us not only to help with our spiritual health, but also allow us to help with our medical health as well, and metabolic health as well. So it's very important to look at our diet and try to limit unbalanced diets. I don't tell you don't have any sambusas, because I'll be not giving you good advice, because I will be having a few sambusas myself. Is I always say, have a balanced diet. There has to be some vegetables. think about your plate. You have to have 1/4 vegetables, 1/4 fruits. This is what we tell our children, rice and bread, and we have juices and we have water. So try to have a balanced diet and try to exercise even during the month of Ramadan so that you are able to maximize in your overall health. Now, we talked about heart disease, we talked about diabetes, and we talked about the importance of, or the one thing we need to talk about is the importance of measuring your blood pressure during the month of Ramadan, because it's important for us to know what our balance is for our blood pressure, especially after the first week of Ramadan, because now our body's adjusting a little bit. And understanding how our blood pressure levels are and what numbers we are looking at in terms of blood pressure. Now, when it comes to the medications, I just want to touch on a few things, which is number one, insulin. Many people who take insulin, please talk to your doctor about how to adjust your insulin levels, because the insulin level is meant, and the dose you're in for insulin is designed around your day. So if your day is you eat lunch, you eat breakfast, you eat dinner, which is just our general days, then the doctor will have an insulin plan and your diabetes will be good. But if you don't eat for 12 hours, your doctor is going to have to adjust your insulin. And they can adjust it at the times that you are not fasting, so that you are able, inshallah, to fast and at the same time optimize your diabetes. I say that, but at the same time, I say something very important. People who take insulin have to talk to the doctor to see if they are safe to fasting. And I know I said that earlier, but I'm going to repeat that again because that's very important for all of us to recognize that. The other important point is when it comes to medications. Many people come to me, they say, my medication that I take is 3 times a day. It's 3 times a day. So if it's 3 times a day, one of the dose is going to be during fasting time. So they say, I just skip it. And I take my night and the daytime. That's one way to do it, but that's not the right way to do it. The right way to do it is, again, to go to your doctor and say, can I adjust this medication? Can I get a sister medication, a cousin medication of the same family? And instead of me taking it 3 times a day, I take it 2 times a day, before suhoor and after iftar. So there are many ways that doctors can optimize your medications around your day-to-day schedule, right? And that's incredibly important, but the doctor will not know unless you tell them that you are fasting and how do I adjust my blood pressure medications, my diabetes medication, and all of that. Now, one thing I'm gonna highlight, 2 things I'm gonna highlight is our spiritual and our psychological health. We spoke a lot about food, and we talk about the heart disease, we talk about diabetes, we talk about general guidelines. But I think it's important when we talk about health in Ramadan, we recognize that not only are we fasting, but we are also, increasing our salah, inshallah. We are going to the masajid, we are visiting our family, we are spending more time together. It is important for us to consider this as a spiritual journey so that to help us improve our own psychological health. Because all these different... Sorry, maybe if we can get people to mute, please, so other people can listen. Brother, can you get them? Yeah, perfect. Excellent. So in terms of our spiritual health, we are focused in our salah, in going to the masajid, in spending time with family. A lot of us before Ramadan, we're so busy. We're trying to make ends meet. We're trying to work. We're trying to do all this. We go to Ramadan and we're like, subhanAllah, we feel so good. Now it's important for us to have the right intentions, to start building our spiritual health and that has direct impact to our overall psychological health and mental health. Now I'll tell you one thing. The reason I tell you this is important. One of the main factors of why people have uncontrolled blood pressure is stress, anxiety, and difficulty with dealing with the day-to-day activities. So the first thing, any patient that comes who starts having high blood pressure, the first thing I ask is I don't ask about their heart disease, I don't ask about their diabetes first. I always ask about their stress levels and how they're managing that. And we all are guilty with dealing with so much difficulties with our day-to-day life. May Allah subhanahu wa ta'ala make it easy for everyone. But it's important to use Ramadan as a mechanism for us to build some habits that help us enhance our psychological health by focusing on our spirituality, inshallah. And subhanAllah, every action we do for Allah subhanahu wa ta'ala has, inshallah, benefit for us in the akhirah, but there's also lots of benefits for us in the dunya, for us to help become better human beings when it comes to our overall psychological health, our spiritual health, and overall our medical well-being, inshallah. The last thing I will leave with, and I will end with this, and inshallah we're going to open it up for questions and answers, is actions during Ramadan. I will say one thing. I work at a hospital, and there are many Muslims who are admitted in hospitals all over the country. And how do you think they feel when they cannot be in Ramadan at home with their loved ones being close to them? It is very difficult. It's difficult for the families who come visit them. It is difficult for the patients that are there. So one homework and one recommendation I give everyone is, I say, and there's a lot of ajr. I can talk about the hadith around this, but I will leave it to, inshallah, more expert individuals around this. But it's the amount of stress relief and happiness you give to Muslim patients if you visit them in the month of Ramadan is going to be incredibly valuable. So I recommend everyone, don't focus on, I don't know someone who's very close to me in the hospital. Think widely. When someone's in the masjid, is there someone in the masjid who has family in the hospital? Let's go visit them. 5 minutes, 2 minutes, go visit them. And inshallah, there's going to be massive ajr for all of you guys to do this. And I promise you, it brings people so much happiness and love when they see people are caring for them and coming to see them and coming to visit them to the hospital. Inshallah, may Allah subhanahu wa ta'ala accept from us. May Allah subhanahu wa ta'ala give us an opportunity to be part of Ramadan. Allahumma ya Rabb ballighna Ramadan. And of course, we always have to remember our brothers and sisters in Palestine and in Gaza who are struggling in these very difficult times. And we have to keep them in our du'as. We have to keep them in our charities. And we have to, inshallah subhanahu wa ta'ala, always make them a center point to our du'as in our day-to-day basis. And I say this because it is important for any of us, in any talk we do, for whatever reason, to remember our brothers and sisters, and Allah subhanallah, allow us to be strong and steadfast and do whatever we can to shed light on the injustice and focus on advocating for justice for our brothers and sisters in Gaza and Palestine. Jazakumullah khair. Barakallah feekum ya Rabbil Alameen.
Barakallah feek, Dr. AbuBaker. We really enjoyed your talk. May Allah reward you for all of that. Jazakallah alf khair. This is Dr. AbuBaker. I didn't want to talk a lot about Dr. AbuBaker for people that don't know about what he's doing, what he's done. MashaAllah, he's been with us since day one. He's been with every single initiative, any initiative around that he thinks and we all think that has something good for the community, something good for the Muslims. He's always been, if he's not the first, one of the first few. Jazakallah khair. This is nothing new for you. Barakallah feek. Thank you everyone for listening. Now we thought we'll give more time for questions. Dr. AbuBaker, I have a few questions that came here. You can send your questions on the chat if you want, or if you want to talk, but as long as it's quiet at the background, just to be able to hear the questions. I think I have a question here, Doctor. This is Jazakallah khair from Brother Muhammad Adam. Okay, so I can start. We have a few questions already being asked. One is, Dr. AbuBaker, what do you think is the best way to break our fasting? When I say practically, so it's Adhan Maghrib. Now, what is the best way to start and break our fasting?
Yeah. This is again a medical talk, so focus on the medical.
Yes, yes,
So I
that's
think it's
correct.
very important to ensure that when we have a diet and we have so here's the point. There's general advice and there's people who have particular disease process. And in our families, I can promise you, in every table we sit with our family. If this person is healthy, the other person is healthy but might have high blood pressure. The other person might have diabetes. The other person might have uncontrolled diabetes, and you don't know if they have uncontrolled diabetes. So here's number one. Number one is when we're cooking food for the family, let's make sure we get rid of elements or particular things that have high risk of problems. One, excessive sugar and excessive carbohydrates. So whoever's cooking in the house or whoever's ordering Uber from outside, let's limit and not have excessive. And I focus on excessive. I'm not saying don't have it all. No excessive carbohydrates, no excessive sugar, and no excessive salt, right? For some reason, I hear this all the time. Everyone understands the no sugar part. But when it comes to salt, they say, I don't take sugar, and they're pouring the salt in their food. So it's very important to think about that. The other thing is, when you're inviting people over, people who come are not going to tell you. Some people do, and I recommend that. People say, you know what, I don't really have a lot of if there's something with less sugar or something with less salt. But always when you're cooking, account for the people in our community, and particularly make sure your salt, addition to the food is generally minimal, little bit of salt, not too much. So these are the general advice on the sugar and the salt. The other important point is people always say one thing in the diabetes clinic when we come. They say, you know what, I don't have this sugar, but I have a lot of I have juice, right? So it's important to consider that juice, yes, it is having fruits is healthy, but at the same time, excessive fruits has a lot of sugar. And we have to be able to recognize that, because yes, it's organic. Yes, you don't add more sugar, but it generally intrinsically has a lot of sugar. So be careful of that. Don't say I'm going to drink 3 bottles of particular juices because it's organic and I added no more sugar. You're still having a lot of sugar in there. So try to focus on have some vegetables, have some fruits, have some carbohydrates, and have water. Even when we have our tea or we have our coffee, limit, if anything, try to learn to reduce the sugar as much as you can, inshallah.
Barakallah feek, Jazakallah khair. Yes, it is from a health point of view, as you mentioned, because inshallah, just as a reminder to everyone, we'll have the 2 points that Dr. AbuBaker mentioned earlier, the spiritual and psychological part for a Muslim during Ramadan. Inshallah, tomorrow will be we have our Sheikh Tawfiq Asayr. He'll be talking about the spiritual part, inshallah. And on Sunday, will be Sister Muna, that she will be talking about psychological part. Just wanted to highlight that one. Okay, any questions? Let me see. Sorry, I just need to see.
There's Uncle Najib, I think, has his hand up.
Yes, okay. Okay, we'll just read this question. Sorry, Uncle Najib, just 2 seconds. Brother Muhammad Adam, how is it working? I'm fasting. So I will read it literally how it's written. It could be difficult to work while fasting. What advice would you give? Yeah, from your experience. Jazakallah khair.
Very, very good question. I think it's important to recognize what is the difficulty in the fasting during work. Number one, it's important to recognize if you have particular problems with sugar, for example, diabetes as an element, as a disease process. If you notice that you have diabetes and you notice that while you're fasting, you are getting tired, you feel dizzy, lightheaded, right? Don't just say, oh, it's because of the fasting. Check your sugars, right? And if you recognize that your sugar levels are low, don't say, thought is like in 4 hours, I'm just going to try to push. Because there is no, I'll leave this to Sheikh Tawfiq Asayr, inshallah, to talk more about this, but I do not believe, and there is no compulsory fast when you are sick and you are incapable to fast because of your particular disease process that you have. So being nauseated, feeling like you want to vomit, feeling like you're getting dizzy or dehydrated or lightheaded, it's something that's important for you to have something to eat and to drink. I think that's important to say because many times people normalize this. They say, I have diabetes, it's hard for me to work and fast. The reason is because their sugars are low. So it's very important to recognize that and check our sugars regularly. When it comes to working and fasting, I think the big challenge that people have is around not just necessarily not eating, it's the lack of sleep as well. Because many times you end up going to Taraweeh, you end up coming back, you end up waking up for suhoor. So the timing of sleep becomes minimal and in general in Ramadan. And I really do recommend that sleeping is important. It's important for us to make sure we have segments during our day where we can rest so that we can allow our body to rest and our hormones and our proteins, all of it to be stabilized a little bit more. So it's important to address our sleep. The last thing is around suhoor. Our Prophet ﷺ recommended us to wake up for suhoor. And whenever the Prophet ﷺ and our deen recommends us to do something, there is most definitely a wisdom to it. And one of the wisdoms is that it allows your body to have a particular energy level and particular energy stores in order to manage your day. So many times, if you don't have suhoor at all, you're not sleeping, you're fasting, and you have high blood pressure or you have high diabetes, you're gonna even feel more tired than general.
جزاك الله خير. Thank you. بارك الله فيك. الأستاذ الأخ نجيب.
نعم السلام عليكم.
السلام.
جزاك الله خير Dr. AbuBaker for this very important topics, and جزاكم الله خير ECCC Center. My question is to Dr. AbuBaker. Well, if I have a diabetics on type 2 and the sugar is under control, but if there are medications that I have to take it every 8 hours during Ramadan, I heard you were saying that, well, I'm not going to take your consultation. As you said, we have to talk to my doctor. But I want you to just tell me in Europe, if you take it twice, that will not affect. This is number one. Number two, on our age, we don't make heavy exercise, but we used to make some very light exercises. Don't you think that during Ramadan, the exercise of Taraweeh and the exercise of this, that will not be enough for us?
It's a good question. No, it's a good question. And I think it's, I'll start with the second question, then I'll go to the first question. You raise a good point about, actually, subhanAllah, we have the opportunity to exercise even during Ramadan. One thing I tell people, park, when you go to the masjid, we always complain we can't find parking. Well, here's your exercise activity. Park far and start walking to the masjid, because when we talk about exercise in medicine, we're not talking about excessive exercise. If you walk for 60 minutes a day, right? You actually have done enough exercise for the day, and that's actually really good for an average individual who has diabetes or has any high blood pressure. So my recommendation, if you park maybe 12 minutes, 15 minutes from the masjid, you start walking 15 minutes to Taraweeh, walking 15 minutes back, you go for another fard prayer, 10 minutes, you recognize that you're already hit almost 60 minutes of walking a day, plus the walking that you do on a day-to-day basis. On your day activities. So that's one recommendation I have. You have to get agreement with all your wives about how far you want to park from the stores or from the masjid, but I'll leave that agreements in a personal level. But I think it's important for us to start parking far, because that's a quick exercise. So that's one tip I give to patients. Anytime they say we don't exercise much, where do you go? You go to the mall? Okay, park the furthest away at the mall and start walking. So that's one thing. The second part is around, you said 3 times a day of medication. most of the time, for 1 month, the doctors can adjust your medications around. Most of the time, right? Because most of the time, our process in general, Ramadan or not Ramadan, I don't like to give medications more than 2 times a day. You know why? Because we forget, right? So I can give the medication, I feel good about it. I can tell you right now, when we do research, we know that more than up to 60%, not more, up to 60% of patients will miss one of their pills in 1 day, right? And it's normal if you think about it, right? If someone takes 5 pills, 5 medications, 2 times a day, 3 times a day, 1 time a day, I feel like we all need secretaries in order to optimize that. It's not easy. And I tell patients that all the time, it's not easy. So I always try to optimize my medication to 2 times a day, because you can have it when you wake up and you can have it to go to sleep. It's a reminder, waking up and sleeping. So I would recommend Uncle Najib to go to your family doctor or specialist that you see and tell them that I have Ramadan. Can I switch around my medication? Because don't just skip the 3rd one, because he might be able to optimize the dose. Instead of you taking the one in the middle, he can give you more during the day and more at night, or keep it the same, because he knows your numbers, your sugar numbers, your glucose numbers. So that's my, inshallah, recommendation, is to go and talk to them about switching it from 3 times to 2 times a day. And almost, it's very rare that we cannot do for diabetes or high blood pressure.
Jazakallah khair.
الله يبارك لكم.
بارك الله فيك. Thank you. شكرا سؤال, and thank you for the answer. Okay, so I have one more question here. I'll ask again, all our guests, if you'd like to ask, raise your hand, go on the chat. So you can, if you want to speak, just let me know so I can unmute you, okay? Now, this question about that we'll have to ask, right? So it's a school days, doctor, right? Ramadan and school days, right? Talk to a grade 12 kid or grade 11 or university student about studying. What would you tell them, health-wise, again, from the health point of view?
Yeah, tomorrow we'll all come to the Sheikh Tawfiq As-Said's talk, and we'll learn about the religious part. So, inshallah, today is an interesting point for that. You know, subhanallah, when I look back to my time at school and time in Ramadan, I always say that fasting and studying, there is some barakah in it that is very hard to conceptualize. We all meet particular folks around our community who say, I'm not going to fast, I have exams, I have to study, I cannot fast. And it's very important for us, I will say one thing, not to judge people, because sometimes people might have a particular illness that they don't want to really share, so that's why they don't fast. So please don't make any adjustments, don't make any judgments, because that impacts people on a day-to-day basis. So when someone doesn't fast, please don't look at them differently, especially when they're young. Because when they're older, we automatically assume they might have some illness. But when they're younger, right, and they're not wearing a thobe or a kufiya, we might make our own judgments. So it's very important for us as a community to not fall in this shaitan trap, because they might have diabetes, they might have a particular medical problem, but they're shy and they don't want to talk about it. And to be honest with you, as a physician, they don't have to explain it to you. And they don't have to explain it to the community. Why is it they don't fast when they have a medical problem? So I say that to university students because that is a reality. Many people are taking particular medications and they cannot, not many, but there are some people who take medications that they cannot not take. So that's important to recognize. When it comes to studying and fasting, everyone knows their body and knows their schedule and knows how to organize what works best for them. I will not say stay up all night studying, because there's opportunities to do more khair at night than studying, especially in the last 10 nights of Ramadan. But my recommendation is find groups of people who are fasting like you, right? And study together, because it makes the process more simpler when you're studying with a group of people who are fasting, right? One, you will be able to adjust the schedule around your iftar time, makes life easy. Number two is you will remind each other to pray together. And number three is that it allows everyone to be more efficient and organized. Because when you're not fasting, you might say, I'll study now for 3 hours, then I'll study after sunset for 3 hours. And I can't study after sunset. I have to have iftar, then I want to go to the masjid. So that's the biggest advice I give people, is to always focus around people that fast like you, so that you're able to optimize your time better. You're able to remind each other about the ibadat we can do together. And that's very important. Now, one thing I want to highlight before, about one question, I don't know if I got this question or not before, is mental health. As a community, we don't talk about mental health, right? As a community, we don't talk that people within our community take medications for mental health, right? This shouldn't be a surprise to all of us. This should be something that we recognize, not just in our Eritrean community, in our Muslim community, in our Canadian community. That's the reality. So there are particular individuals, going back to the no judgment part, there are particular patients in our community that require to be on mental health medications during the month of Ramadan, that might have psychological and mental adjustments that are needed during the month of Ramadan. So it's very important, if we know people like that around us, we know because we have a close relationship with them, we empower them, we support them, we be there for them from a social and a psychological perspective, right? And I think this is very important, because we don't want to single people out who have mental health, in the month of Ramadan, but we want to give them an opportunity to be empowered by the community, and whoever knows about people who are struggling with mental health problems, support them, be there for them, because there's a lot of ajr, inshallah, in that.
Jazakallah khair. Jazakallah khair. Okay, so I know how busy you are, Doctor.
No problem. If there's more questions, go for it. No problem.
Yeah, there's okay, I'll have to ask the question that comes here. So here says, what age should we ask our kids to start fasting? Right.
So that's a question. Okay.
Yeah, it will be in a way, but we look at it again. There will be questions, as he said, from a different angle, no? So this is the medical part that we are trying to figure out. Yeah, and I know it's different, but all yours now.
It's a good question. I will preface by saying I'm not an expert at that, but it's actually a very interesting question from a medical standpoint. When is it considered too early to fast or too late to fast? Like purely from a medical standpoint. To be honest, I will say that I am not sure, to be honest, how to answer that question from a medical standpoint. I don't know that, but what I will do is this gives me research for me to do myself and to talk to my other pediatric colleagues and get their opinion. Inshallah, I'll have a better answer for you guys next time, inshallah.
Jazakallah khair. Jazakallah khair. And there's another question. Now, this one is, I'm assuming, is from Sweden, because it says, in Sweden, they do fast very long hours. So after a week, it's just completely lethargic. Everyone is just completely out of energy. So the question is, what's your advice to stay energetic? That's what I'm just rephrasing the question, to be honest.
No, it's a good question. You see, when we think about intermittent fasting, like just in the secular sense, not Islamic sense, when we talk about intermittent fasting, some people fast 16 hours, right? And some people fast 18 hours. Of course, they drink water. When they talk about intermittent fasting from a medical standpoint, we're different. We don't drink water or we don't eat. So people who have problems with kidney disease or people who have problem with diabetes or heart disease, you are at risk of dehydration, and that could not be good. So when it comes to disease, I agree with you. If you have any particular illness, that's a caveat for you to discuss with the physician, and perhaps not fasting is best for you. But when you really think about what fasting does to your body after a period of time, it many times increases your energy levels, right? Because your overall metabolics and your hormones are stabilized and adjusted, right? So when you think about you're losing your energy because of fasting, think about the other habits you're having. Many times people say I get tired because they fast for 16 hours and look at the meal they eat. massive, feast, ruz, laham, high carbohydrates. In general, when you're not fasting, I mean, let's all ask ourselves that question. When we're not fasting and we eat a big meal, you feel like you're sleepy, you're tired, right? So now when you're fasting and you do that, you're gonna even feel more tired and your energy level becomes unadjusted, because what you're doing is you're taking away the benefit of the fasting by giving yourself every day at iftar time a shock to your body. You're just throwing shocks every single day. So it becomes harder for the body to handle. Your energy level can fluctuate and your hormones can fluctuate. So my recommendation is, when we look at the fasting, try to optimize everything else. Sleep, how we eat, and how we adjust our day to day. And at the end of the day, I say this is important for the healthy individuals with no medications that they think about fasting. It is an end of the day, like I said at the beginning of the talk, it is a commandment from Allah subhanahu wa ta'ala. And whether it is hard one day or easier another day, may Allah subhanahu wa ta'ala give us ajr for it. Because that is what we are trying to do, is seek pleasure from Allah subhanahu wa ta'ala. And when it comes to fasting, particularly for our healthy people, can mute themselves, please. I think the other ECCC account.
Actually speaking.
Yeah.
Maybe you can. Okay, Ustad Abdul Qadir. Uncle Abdul Qadir has his hand up.
Assalamu alaikum wa rahmatullahi wa barakatuh.
441901. Okay.
1 second. Maybe Sanamra, you're able to just, if you're ready, you can just probably mute all.
Okay, let's see. Close the task, cancel it.
Maybe you can mute all. Okay. Sanamra, are you able to?
Okay, so Hydro is back. Okay. I'm not sure if I can close it because we were told that it's only the technician.
Okay. We'll give it a second here. Sorry, everyone.
Sorry about that. Now.
Yeah, there you go. Now you're better.
Now,
okay. Perfect.
Sorry about that.
No problem.
Okay, Brother Abdul Qadir, I will allow you. Okay, Bismillah.
Assalamu rahmatullah.
Thanks ECCC for making or for organizing this arrangement. And Jazakallah khair, Dr. AbuBaker, for the valuable advice. Just I was wondering, we need to drink an appropriate amount of water after iftar till sahur. The question is to avoid feeling heavy and uncomfortable. At what intervals do you recommend to drink water?
Yeah, thank you. That's a very good question. I think in general, one of the key recommendations is to ensure you're always hydrated during Ramadan at the times when we are not fasting. That's very important. And I say this, but I also say it's very important for us to drink water, but start having more complete, like there are some electrolyte drinks that you can have, especially before going to Taraweeh or things like that, that will make sure you have water as well as all the salts that you need in order to keep you energetic. So I think it's very important to, yes, drink water, but also like, no sugar Gatorades, the fluid IV waters that are full, have a lot of minerals and salts that are good for us to a certain degree, not excessive, can help us with our energy level. So I think that's important. The reason I say this is because I don't want everyone to just drink like this big water bottles every hour or so, because I'll be honest with you, some people do that, and when they do that, their salt levels go down significantly, especially because you're fasting the whole time. So yes, we always say keep hydrated, but don't overdo it, right? So every few hours, some water, 2 hours, have a glass of water, 3 hours, have a glass of water as you're doing your day-to-day activity. I think that's very important during the month of Ramadan, and also have some balanced drinks associated with it, inshallah.
Jazakallah khair. Thank you.
Allah
Thank you. Barakallah feek, Sir Barakallah feek. I think we'll come to a close now. Dr. AbuBaker, you have about, 30 seconds.
Allah barik lak ya Rab. Jazakumullah khair. May Allah subhanahu wa ta'ala bless you for all your work. May Allah subhanahu wa ta'ala give us the opportunity, inshallah, to catch Ramadan and make us from the people that are accepted in the month of Ramadan. We do sessions like this so that inshallah we can all benefit and benefit people around us, and we can all learn something from each other, and just keep us all in your du'as during the month of Ramadan. And I would say one thing, that my contact details is not a secret to the community. So if anyone has any particular questions about medical issues that they might be having, whether it's diabetes, whether it's high blood pressure, whatever the situation is, please feel free to always reach out, and inshallah I'll be able to, if I don't know the answer, I can at least connect you to someone who might know the answer for your particular concerns. So I say that if anyone has any questions, please feel free to contact me, and I'd be happy to support in any way, inshallah.
Jazakallah khair, Dr. AbuBaker. At the end of this very enjoyable chat, in fact, it's very strange, because every year we do talk, and then there's the following year we talk about Ramadan, and there's something new, some new information, or some way of looking at the same thing, subhanAllah. And that's, as you said, this is the benefit of discussing, having these chats. It's always an eye-opener. As you said, if you don't know, you will be able to look and search for it. Barakallahu feek. Thank you for everyone who attended our chat today with Dr. AbuBaker Khalifa, internal medicine and intensive care unit physician and assistant professor at McMaster University. Thank you very much, and inshallah we'll see you tomorrow for our second part of our Body, Mind and Soul series for this year. Jazakallah al khair, and assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullah. Jazakumullah khair.
Jazakallah khair. Assalamu alaikum.